Well, good morning, good afternoon, good evening, wherever you are. Welcome to the fourth webinar in our series on remote interpreting. Feel free to write in the chat wherever you might be coming from, whichever country. We had 41 countries last time, and I think it was 42 US states and DC and Puerto Rico. We welcome you wherever you're from. And I am really excited because this last webinar in the series is about healthcare remote interpreting, and we're bringing you two really passionate, not just specialists and experts, but passionate advocates for the field of healthcare interpreting in general and quality remote healthcare interpreting in particular, namely Tatiana Sestari and Danielle Meder. During this presentation, and if you wouldn't mind sharing your screen at this point, thank you, Tatiana. During this webinar, we're going to ask you, and we'll ask you more than once, if you would be kind enough to put your questions for the presenters in the Q&A section or menu on the bottom of your screen, and any chat would go in the chat feature. In other words, any general administrative questions, I'm going to explain certificates briefly in just a second, or any questions for cross-cultural communications. However, I'll be happy to stay on. This is a 1-hour webinar, and I'll be happy as the director, founder, owner of cross-cultural communications to stay on and answer any questions you may have about this series of webinars or any of our other training programs. Just so that you know, cross-cultural communications, if you're new to this series, we are the only national training agency in the US for community and medical interpreting. We are famous for our license programs. We have about 360 licensed trainers in 39 US states, DC, Guam, Puerto Rico, and 6 other countries. And we are as passionate about the field, I think, as our amazing presenters. If you just want to show them the next slide, please, Tatiana. We get a lot of questions. We get hundreds of questions after every single webinar about certificates, and our staff will be repeating this information, so don't worry if you miss it in the chat feature. They will repeat it. But we have now automated the procedure since the last webinar for getting certificates. But the rule is really, we can only issue them to participants who are attending the live session right now, and not who view the recording later. So if you want a certificate, that's great, but you have to be here to get it. And we are very sorry that it is limited to 1,000 people, so we can only give out that many certificates. The delivery process is automated. You do not need to ask for your certificates by email anymore. That was true for the first 2, not for the last one, not for this one, in this remote interpreting series. And you'll get an email just within 24 hours after this webinar ends, an email that will be sent to all of you who are attending here today. Next, Tatiana. This series, which we have been so excited, we had no idea how popular it would be, is the 4th and last one in this series. But I'm about to announce another remote interpreting series on remote simultaneous interpreting in just a second. You saw the first one, 3 weeks ago with, or 4 weeks ago, with Catherine Allen, gave the kind of overview. You can still access that. If you missed it, don't worry. The same link that you'll get in this email will take you to where to see all 3 of the previous ones. Then a week after that, we had Carolyn Raymer from Boostlingo, who walked you through how to set yourself up for remote interpreting as an interpreter working off by phone or video remote interpreting. And then the 3rd webinar last week, which included Tatiana, working with her colleague Sarah Stockler-Rex, was about, well, how do you conduct yourself as a professional interpreter when you're interpreting remotely, whether on the phone or video remote interpreting. And finally today, healthcare remote interpreting for all of you. And this will be a treat. But we've had so much demand and questions and pleas for information about remote simultaneous interpreting that we are going to launch a series. The first one will be launching in the middle of May. So it will be a series of 3 webinars taking place on Wednesdays. So we're going to be switching from Thursday to Wednesdays. The first one will be on May 13th, Wednesday, May 13th. So keep, look out at your email for information about that webinar. Well, without further ado, it is time to turn this over to our amazing speakers. Tatiana and Danielle are both going to introduce themselves. They have amazing backgrounds. I mean, how often do you get to hear a pharmacist, pharmacologist, researcher, professor, manager, and remote interpreter? That is Tatiana I'm talking about, who is a director of language service advocacy at a really respected and large language company here in the United States, and from another large language company, a nationally certified American Sign Language interpreter. Yes, go Danielle, who has a huge and vast depth of experience in the industry and an incredible passion for working with both signed and spoken language interpreters. They will now introduce themselves, but I just want to say how excited we are to have them and to assure you that you're in for a treat. Danielle and Tatiana, the show is yours. Have fun.
Thank you.
Thank you so much. Yeah, it's a pleasure to be here, honestly. And if this is the first time you're joining us, know that the materials shared here in this presentation and the whole series originate from an ongoing project that we have been proudly announcing during this series of webinars. And it is the Remote Interpreter Textbook. The authors, which are listed here, have been working very hard on the book, but consider important to share part of the content with all of you in webinar form. Okay, so without further ado.
Wonderful. So just so excited that everyone's here. We're going to talk about guidelines for healthcare and remote interpreters. We have a number of learning objectives of things we want to cover, but first we'll introduce ourselves just so you understand where we come from within the industry. As Marjorie said, my name is Danielle Meder. I'm a nationally certified sign language interpreter, and I've been interpreting professionally for 15 years. And I have worked almost all of those 15 years in remote interpreting, whether that is in VRI or in video relay service for deaf and hard of hearing consumers. And I have a certificate in healthcare from interpreting at RIT-NTID. That is a program really focused on healthcare interpreting practices and interpretation. And my passion within remote interpreting really is in healthcare. And so I'm just so honored to be here today, honored to be here with Tatiana and to be writing this incredible book with just so many thought leaders within our industry, and just make sure that we are providing absolutely amazing quality and effective language access for everybody in a healthcare setting.
Thank you. And I second that, Danielle. I want to add how excited I am to present for the first time a webinar together.
Yes.
And I hope we help many of our listeners. A little bit about me. My name is Tatiana Sestari. I'm a pharmacist, a pharmacologist with a national certification in healthcare interpreting. My experience in interpreting has been mostly in healthcare, via video or phone, so remote, and specifically in consecutive mode. I have been a trainer, educator, and mentor to interpreters in healthcare professions in general, not just interpreting. And part of that, I did it when I was, when I served as Interpreter Education and Compliance Manager at Marty. And then I currently serve as the Director of Language Service Advocacy, which is a position that now allows me to basically help bring best practices in language access to hospitals and healthcare organizations, and also remote interpreters across the US. So we can't wait to share with you and to show you what we have in the remote interpreter book.
Yes, it's going to be great. And so this is just a nice teaser for all of you.
Absolutely. Yes. All right. So before we start, let's start talking about some of the things we have to assume for this webinar, okay? Due to time limitations, we need to assume that you have been fully trained in basic aspects of interpreting and that you have been, or you have had some experience in remote interpreting, or maybe not, actually. Some of you, I know some of you don't have that remote experience. Some of you may have some, and that's fine. And we're also assuming you have some level of training, knowledge, or experience in healthcare and medical terminology, because we want to make sure you understand, and I'm sure you understand we cannot cover all that in 1 hour, okay?
No.
All right.
We're going to do some polls here just to get an idea of who's out there. I'm looking at it right now. We have 811 participants. So let's just get a pulse on who's out there and just see what you're all coming to the table with today. There you go. So you'll see there's 3 questions. Are you a healthcare interpreter? Have you completed any specialized medical interpreter training? And then do you hold any certifications? So that's CHI, Core CHI, CMI, QMHI for those sign language interpreters out there, the qualified mental health interpreter, any others or none?
The answers are coming in fast and furious.
Good. It's fun to always look at the chat and see where everybody's from. So we've got representatives from all over, which is great. I've seen a couple of sign language interpreters out there too. Hi, everyone.
Indeed.
There we go. I'm in Minnesota too, so it's nice to see some fellow Minnesotans on here and our neighbors in Wisconsin. I worked in Italy a bit, so ciao.
We've had amazing representation from Italy for some
Yes,
reason for all 4 of these webinars.
Yes,
Go
it's been
figure.
great.
Well, it looks like you've got most of the participants have answered, not all by any means. Would you like me to close?
Sure.
All right. Shall I share the results for you?
Yes.
There you go. Can you see them?
Great. Wonderful. All right. Lots of folks.
Very, yeah. I mean, it's a good 3/4 of the audience, more than 3/4. I mean, that's our healthcare interpreters. More have completed specialized training than not, and quite a number hold certifications of various kinds. Very, very interesting.
I got 2 folks with QMHI out there. That's awesome.
All right.
Yeah, it doesn't register, but we see 2 folks there. That's great.
Let me know when you'd like to stop sharing and move on. You think you're ready? There we go.
All right, well, thank you for your answers. And we have a very rich agenda today. This webinar will focus on identifying and addressing some challenges to interpreting remotely in healthcare, how to acquire some specialized medical terminology, tips to be assertive in this field, certain fields that may intersect with healthcare, and briefly a touch on credentialing and professional organizations in healthcare interpreting. So Danielle will now explain to us how we will do that. Oh, no, you know what? Before we do that.
Let's get our setup. There you go.
Yes, before we do that, thank you.
We're just so excited to get to the content, you guys.
Yes.
But we'll set the stage a little bit more.
Yes, so here's a recap of important items we have talked about throughout this series of webinars. So basically, as a remote interpreter, you need to make sure your office space is compliant with certain laws, right? Here in the US, for example, with HIPAA, the Health Insurance Portability and Accountability Act of 1996, that your office is well lit, quiet, well ventilated, private and secure. This means, of course, that your home office has doors that you can close, and if there are windows, that they have blinds and you can close them so that people don't really see what you're signing or what you see on your screen, right? Of course, you should have a computer connected to a high-speed, private and secure internet connection, or a telephone landline to use for over-the-phone interpreting. And of course, a way to destroy your notes. It's very important. If you have a shredder, that's ideal. And it's recommended that you use backdrops or mounts that are totally blank. If you cannot obtain one of those, you can use like a wall, a blank wall that's on texture behind you with no photographs or other decorations hanging to keep your image very professional, not distracting, and safer for you and your family. So basically, do not do what I did. Do not have all this distracting stuff. Do more like, so our good example is Danielle today. So she has a blank background, centering camera, have everything she needs in a private and secure environment, okay? And of course, use an ergonomic chair, so that you maintain good posture. Very important, have your writing utensils and water with you and ready to use them, of course. And last but not least, text your connectivity, your internet connectivity, your devices, your software, your noise canceling capabilities, and also your lighting. Any sounds levels, your camera view, your camera presence, dress professionally, wear solid colors, and make eye contact as much as possible, okay?
Thank you. So what we thought we'd do today is, instead of talking about healthcare challenges and as a remote interpreter abstractly, we would root it in an appointment. So we're going to make a couple assumptions. And what we're talking about today can apply to OPI, but for now we're just going to kind of drive home in this 45 minutes left here about VRI. So you're on a VRI platform. Your patient is an 11-year-old boy, inpatient, which means the emergency room visit has been completed, diagnosis is ready, and they're going to be putting the patient into inpatient care. Language dynamics, the parents speak Arabic, but the child, the 11-year-old boy, speaks Arabic and English. And then the diagnosis is recent diagnosis of juvenile diabetes. So they were admitted to the ER for a number of symptoms, finally figured out that it's juvenile diabetes. So when we talk about all our challenges today, we're just going to root it back to this to help you kind of visualize where we are and what we're talking about. So we have challenges when we're not on site, right? Cameras come on, you don't get to see the whole room. You see what's in front of the camera. You can't always see the body language. You're not able to see everybody. You may only be able to interpret in consecutive, largely so for spoken language, but even also for sign language interpreters, while we can interpret simultaneously, sometimes it's better to have more controls and interpret it consecutively, which means timing. And then you might be rushed by a provider, a doctor who's got a timetable to keep, lots of patients waiting, and he's in a hurry and has probably less patience for the interpretation process than he should have. But we have strategies, solutions for handling that. When you come on camera and you can only see one person or only a couple people, but you want to make sure you know who's in the room, ask. You are the interpreter. You are responsible for communication and making sure everybody's voice is heard in the language that's going to make them communicate the most effectively. So ask who's speaking. Ask who's in the room. Ask for the patient to be on camera. If you've done VRI before, it's pretty funny when you get a provider or a clinician who will click on the camera, get the interpreter on the screen, and then they just want to look at you. And it's like, well, Where's the patient? And while we want to see everybody, we need to prioritize somebody to be on camera. Now, for sign language, we have to see the deaf person because they're signing. But in spoken language, we also want to see the patient, because while the doctor and what he's saying obviously is very critical and important, we want to be able to pick up on all that body language that's coming from the patient or the key family members that are in the room. And so being assertive and professional and saying, this is the interpreter speaking, can you point the camera towards the patient for me, please? Right? Or sometimes we've had people call in on an iPad and they put the camera up and you're looking at the ceiling, right? And you're thinking, well, you're calling in on VRI. We should probably want to see each other. And you know how it can be when you see someone who speaks your language, understands your culture, the engagement's so much stronger. So you want to have that connection with the patient or the family that's relying on the interpreting services. And now we know doctors, clinicians, nurses, ERs, hospitals, clinics, they're busy places. Everyone's in a rush. But that can't determine how quickly you interpret. You are the interpreter. You are responsible for communication, and that is a privilege and an honor to be in that environment. So if the doctor or the clinician is saying, okay, well, I have to go and you're not finished interpreting, this is the interpreter, one moment while I finish interpreting. Using your interpreter voice is the best tool you can have when trying to manage that call flow, manage those communication dynamics. One moment, this is the interpreter speaking. Let me ask for clarification. Let me finish interpreting, politely, professionally, but assertive. No one gets to tell you how to do your job as an interpreter. We would never go to a clinician and say, I think he has the flu. Have you considered giving him a flu test? Right? None of that. We would never tell a doctor what to do, so we don't have to take on that burden of rushing because the doctor wants us to rush. We're in charge of communication and we can't leave anything out and we can't hurry, because the person who suffers the most from that is the patient or the patient's family. Okay, next slide. So we have our 11-year-old boy. He's the patient, but he speaks Arabic and English. And while he is the patient, the doctor's going to be asking a lot of questions and probably asking about his health history with his family, which means while we're focusing on the patient, we're also going to be talking to the parent. So we can kind of be talking above the patient. We might also see this when we have an elderly patient with adult children who speak both the patient's language and English. And so we don't want to lose track of that patient. We don't want to lose track of comprehension and following along and making sure everybody is on the same page. So you as an interpreter have to really pay attention to body language, those nonverbal cues. You're there to interpret from one language to another, but you're there to also use all the parts of communication that make your job successful. You can go ahead to the solutions part, Tatiana. So that's the body language. If they're asking parents the questions or the patient the questions and there's this blank look on their face, stopping and making sure you pay attention to that. Those nonverbal cues are a huge part of communication, and we talk about that in the remote interpreter book, that you see how much nonverbal plays into what we say. It's not just what we say, but how we say it, okay? Now, we're in inpatient. We've just gotten a recent diagnosis, juvenile diabetes. And that means there's going to be lots of specialists coming in. They're going to be coming in asking questions, giving education, talking about health history, symptoms. You as an interpreter may not even have had a briefing beforehand. You may have come up on camera and then there you go. And you are dropped into the middle of an environment and you're trying to get your bearings as an interpreter. 100% okay to say, this is the interpreter speaking. Can you just give me a quick brief introduction to the purpose of this visit? You can identify yourself, ask them to identify who they are and what the stage is. It's okay to ask. You are an interpreter. You're not a mind reader. You're not supposed to come and do a call and be able to figure it out immediately. You want to take a look at the room, try and pick up on those cues, but sometimes the room may not really reveal what we're taught, what the point of the appointment is. You may be in a pediatric room, but talking about something very serious. Or you may have a patient who's in a OBGYN looking environment, but we're not there to talk about OBGYN. We're there to talk about something else. So we can't make the assumptions. We can try and pick up on the cues, but you can ask. This is the interpreter speaking. That interpreter voice gives you power and control to make the best and most informed decisions as you go forward. They don't need to give you a 2-minute introduction to what's happening. All they have to do is give you a 30-second elevator pitch on what's happening. And then make sure you give that information back to the patient in that patient's language or in this case, the parent's language, this is the interpreter speaking. I was just asking them the purpose of this visit so I can get my feet settled. Okay. Language dynamics. So this is a fun one. You have a patient who's bilingual, and you have mom and dad who are only able to speak Arabic, right? So the doctor will say, okay, John, tell me how you feel when you XYZ. So the doctor may start talking to the patient in a real conversation, and you're an interpreter. You can't keep up with that. We need to have those turn-taking modalities. Never, ever, ever should you just sit back and let it happen, right? You interject and you say, this is the interpreter speaking. One moment while I interpret for mom and dad so they know what's going on, right? It will slow things down. It may make it awkward, but that doctor has to understand that everybody in that room has the right to know what's going on and have a right to interject, because while he's 11 and he may think he knows all the answers, maybe mom and dad will remember, well, when he was 4, this happened. Could this been an early sign of what happened today? So we have to make sure that everybody in the room has that access. And I'm going to say it again, you are the interpreter. You are responsible for communication access. If you take nothing else away from after today, I want you to feel like you have power and responsibility to make sure communication access happens. You have to ensure that you step in and say, this is the interpreter speaking. I know you're asking questions to John, but I need to catch up with the parents and continue to interpret. And also the parents state, they may not actually advocate for themselves to the doctor to say, hey, wait a minute, what are you saying to my son? The interpreter can't keep up. The parents are scared, overwhelmed. Maybe they're unfamiliar with the healthcare system where they are. This might be the first time they've ever even been to an emergency room. They don't know what's happening. And so if you as the interpreter don't advocate for communication access, don't advocate for anything else. Worry about one thing, communication. But if you advocate for communication access, you're really helping everyone. And the parents may not know to advocate for themselves. They might be scared, intimidated, overwhelmed. This is the interpreter speaking, followed by whatever you need to ensure everybody's communicating. Because the patient may know the answers, but he may not have the whole picture because he's a minor. Or you may have an elderly Arabic-speaking patient who's there with her adult children who are all swooping in to take care of mom. And they're really worried about mom because mom's got this new diagnosis. And so the doctor's speaking in English to the adult children in English. And you're the interpreter there trying to interpret, and then you sit back and be quiet. Now that mom, who's the patient that everyone's talking about, doesn't know what's going on. You have to take that time and not worry about a doctor going, you need to hurry up, I gotta go. Or, oh, it's okay, I'm just gonna ask John how he's been feeling for the last month. Never is it okay, it's okay to stop interpreting. And so when you're in remote environments, it can be harder to assert yourself, because when you're on site, you're physically there, you have some sort of physical presence and authority. But when you're remote, you lose that a little bit, but you can make up for it with your voice. This is the interpreter speaking, one moment, please. Okay? Be faithful to that message, right? We don't need to summarize, we don't need to rush, we don't need to hurry. We have to stay committed to that message from the source language to the target language. Okay? Awesome. All right. Now, juvenile diabetes, you may not know a lot about it. I'm going to give you a get out of jail free card, right? You do not have to be the subject matter expert on everything in medical interpreting. You are not the doctor, you are the interpreter. All right, and we're going to talk about asking for clarification later, but that means when you get a VRI call, likely not going to know what it is until you're already in it, and likely you're going to have to figure some things out. Right? There's going to be specialists in this case, education, counselors, nutrition, blood sugar testing, lifelong diagnosis, all of these pieces. You aren't the subject matter expert, but that's okay, right? You can ask for that clarification, which we'll talk about later, but you need to make sure you're picking up on visual cues of the patient or the family's own comprehension. So if your doctor is saying all of this stuff and you're interpreting it, and you can see this blank stare on the patient's face, right? You can say, this is the interpreter speaking. Can you ask if they understand? Don't ignore that piece. Pay attention to that. When you are remote, again, you lose that physical sense of the room. We can all tell how a room feels. It can be heavy and exhausting, and remotely, you lose that piece, that physical presence piece. So pay attention to that. And there's going to be all sorts of people coming in, and you may not have all that knowledge. Totally fine. You're not the subject matter expert, but that's why we say when we asked in the poll, if you are a medical interpreter, do you have any experience in training? Because this is a part of interpreting. You don't just blindly walk into it. You have to do your homework ahead of time, study, prep, expose yourself to different facets of medical interpreting. But then you have to evaluate and think, how much do I know, and what can I do to prepare myself better the next time, and what can I do on the fly? In the remote interpreting environment, how can I gather additional information to support my interpreting? And that's something Tatiana is going to explain.
All right, yes. So medical interpreting, as we know, can be a combination of easy to complex environments or conversations, from rewarding to frustrating at times, you know, and not knowing the terms often that we often use can swing that pendulum toward the frustrating and even risky side of things. So in medical interpreting, you need to be ready to use terminology that you may or may not know, okay? How do you do that? Well, by doing two main things. The first one, have reliable resources ready in case you need to search during the call, okay? So that's the during the call homework you do, besides interpreting, of course. And the second one is use those same resources or other resources to study before and after calls. Now, regarding terms that you look up during the interpretation, use your best judgment to select the option that best applies to the context, because we know that when you search online, you get several translations of the same term, okay? Or in many cases, okay? We know that it is impossible, as Danielle was saying, to be an expert in every subject you interpret, and we don't want that, actually. However, studying before and after taking interpreting encounters or those calls reduces the chances of having problems with terminology and the communication flow in the majority of your sessions. So basically follow any structure that works for you when it comes to studying, but also don't forget to review that term that you didn't know and you had that last interpreting session that you had to look up. And so review it again, understand it, practice how to use it, etc. Okay. One good way to remember what a word means is by, how I call it, deconstructing the word and check the meaning of each component. And this is something that it's widely used in the medical interpreting field. So do you remember those roots, suffixes, affixes? Well, knowing those in medical terminology will save you tons of time and energy when figuring out the meaning of a word, okay? So that is key to knowing medical terminology. And in general, I would say the more proactive you are, the better. Make sure you take continuing education courses, you attend educational conferences, all that is very helpful. But know and make peace with the fact that all these scenarios will occur no matter how prepared you are, okay? So even if you think you know it all, something's gonna happen to let you know that you cannot know it all. And that's okay. There are tools to deal with that as well, okay? So here are some resources that can help you during the call or before or after that call. And we have, some that are for general medical terms. We have a list here. We also have a short list that's more specific to medications. That's what happens when you include a pharmacist in one of these these webinars, that I need to add that touch on medications. And you have there resources from the United States Department of Health and Human Services, some resources from the American Association of Family Physicians, the United States Centers for Disease Control and Prevention. But something that's extremely important is to look for resources that are reliable. And you may ask, well, how do I know if they are reliable, right? So, well, that part is a little tricky, but I would suggest to look for information developed by renowned universities or by, also very recognized organizations in interpreting, or by governmental organizations. At least that would be the case for the United States. I know in some countries that's not the case, but here in the United States and many European countries, that is the case, okay? We also encourage you to communicate with your language service organizations because they may have identified some of those hidden germs of, not germs, gems. So I'm not talking about germs here, hidden gems of information. So if they have done that homework for you, that's great, take advantage of that. All right, so let's go back to our case, to our newly diagnosed patient and his family. And let's think about, what scenarios they may, or what type of conversations they may have with different providers. So I would say that they are going to be seeing some specialists, including an endocrinologist, right? Because the diagnosis was type 1 or juvenile diabetes. And they may receive counseling in addition to education in many areas such as nutrition, blood sugar testing, calculating carbohydrate intake, calculating insulin, the amount of insulin to be administered, how to administer insulin, and you name it. Not that you will necessarily interpret all this content at once, but since he's our patient today, it's our time to think about those things. So I would say be ready to interpret how he may have developed type 1 diabetes, the type of pancreatic cells that we have, the hormones secreted by that organ, especially the ones that regulate glucose levels in your blood, any signs or risks of high or low blood sugar levels. Those are very important, and they always, they're always present in any of these diabetes education sessions. Now, regarding measuring blood sugar levels, be ready to interpret what's a glucometer, the parts of the glucometer, how to use it, maybe about the treatment. You will have to talk a little bit about interpret what type of treatment the patient is going to be receiving, become familiar with how insulin is administered, and also the different pharmaceutical presentations, like the brand names, and how they're administered, of course, if they need to be shaken or not, all those kind of things. How will you do all that? Well, using the same approaches we have been preaching about, right? Study a lot, get your resources ready when you're interpreting. Make sure you check all the unknown words afterwards. And of course, take webinars like this one, go to conferences, take many continuing education courses, okay? Now, Danielle is going to tell us a little more about how to deal with these circumstances.
Right. So as you're going through all of this, maybe you need to request for clarification. Now, like I said before, you're a professional interpreter. You're not a doctor. You're not a clinician. You're not a nurse practitioner. You're not the therapist. You are, in some cases, it's okay to say just the interpreter, right? So ask for that clarification. I go back to your interpreter voice is one of your most powerful tools as an interpreter, whether it's in healthcare or in any other field of interpreting, whether it's on-site or remote. Asking for that clarification and requesting that clarification for your own sanity and your own commitment to the message, faithfulness to the message. That quality and effective communication is only as good as the interpretation you're providing. So you're the interpreter, ask for it. Now, if the patient or family doesn't seem to understand something, that's part of those nonverbal cues that you're picking up on. You have to make sure you pay attention to that so you can say as the interpreter, this is the interpreter speaking, I don't think they quite understand my interpretation. That misinterpretation could lead to serious medical harm. So if they don't understand that interpretation and then they leave the appointment and they go home and then something terrible happens because we didn't stop and say, I'm seeing a nonverbal cue. No one's going to get mad at you. I take that back. You might ask for clarification and a doctor or clinician might get upset with you. That's okay if you're doing it professionally and respectfully, but because you're also a competent interpreter, ask for clarification. We all ask for clarification in every facet of our life in our own language, right? How many of us say, what did you just say? I didn't understand that. What? What are you talking about? Same thing can happen here as an interpreter. I'm sorry, this is the interpreter speaking. Can you say that again, please? Or can you say that in another way? Or I don't see, the patient doesn't seem to understand. There could be linguistic and cultural differences. A fantastic book that came out that I'm sure many people have read, and I have read and is wonderful, that really explains the differences between language and culture, is The Spirit Catches You When You Fall Down. I'm forgetting the name of the author, but fantastic book that just exposed the difference between language and culture from Western medicine and not. And it really gives a beautiful example of that, so that as you are language experts, you're familiar with your patient's culture, likely. You're not the cultural expert on that person because we know there's different subcultures within the greater culture, but you have some inkling of an understanding. Use that to ask for that clarification. It's your responsibility because you may understand, but you need to make sure that the patient or the patient's family understands, or even that the provider understands. And so asking for that clarification is fine. You don't want to own your own, you want to make sure that you understand what is being said, but you also want to make sure that the patient is understanding what's being said, so that when they walk out of that office, out of that clinic, you feel good that your interpretation was successful, because it's about quality and effective communication. The quality of your work and the effectiveness of your work. And it's your job to ensure that happens. So picking up on those nonverbal cues, picking up on the environment. Long silences don't mean comprehension. Depending on the culture and the language, maybe nodding your head along may look like understanding, but it may just mean I'm sort of following you, and then asking for that clarification. Because if the patient or the family doesn't understand, but you do, it doesn't matter, the communication wasn't effective. So you ask for clarification for lots of reasons, not just as the interpreter, but also for communication access and effectiveness between the patient and the provider or the clinician. So how do you do that? Interpreter voice. I'm going to say it again and again and again. Love your interpreter voice, use your interpreter voice. This is not the time to cover things up. This is not the time to, and I'm Anne Federman. Thank you for adding that, Roxana. I see the author's name. The Spirit Catches You When You Fall Down by Anna Federman. Thank you. Read it, especially if you are newer to healthcare interpreting. It's such a powerful book. So back here for requesting for clarification. This is not the time to cover up. This is not the time to, oops, I misinterpreted that, so I'm just going to fix it. Or cover up the patient's not understanding. So go back to that interpreter voice. This is the interpreter speaking. Can you clarify? One moment the interpreter needs to request for clarification. This last one, store this away for your next appointment. This is the interpreter speaking. I'm not sure the family is following what you're saying. Could you please clarify with them if they understand my interpretation? Okay, it's all right if they don't understand your interpretation, because maybe they don't actually understand the doctor. Doesn't mean you're a bad interpreter. It means you're a fantastic interpreter when you're picking up on those cues, when you're owning where you need further clarification. Tatiana just went through how to, on the fly, find some medical knowledge and resources while you're interpreting, but that's still okay if you need to. In VRI, you can be dropped into any appointment, depending on whether you work for an agency or for a hospital directly, and they just start sending you everywhere. When you're on site and you work with your scheduler, or you work with the clinic regularly, you get a sense of where you fit best. You're not meant to be a great interpreter everywhere. Not one interpreter is perfect for every interpreting environment in general, and not one interpreter is great to be an interpreter in every healthcare environment. So when you're in VRI, you have to be assertive and confident to ask for that clarification. Do the homework when you are off the call, but ask for it repeatedly. And as long as that's not a reflection of your underdeveloped interpreting skills, but really just making sure quality and effective communication is happening, then you keep doing it. And if a provider or a clinician gets mad at you, that's okay. Just like we're not on the doctor's watch, you're not on the doctor's patient's level for you asking for clarification, especially in something very complicated like a new diagnosis, something that has got all sorts of elements at play. We're not just coming in for an annual physical or you need to get the flu shot. You're coming in, in this case, for a juvenile diabetes, and the parents are going to have a lot of questions. And so let's say the parents are following along and nodding, but they're just not giving you those cues that they really comprehend. Use that third one. This is the interpreter speaking. I'm not sure the family is following along. You don't have to own, did you understand my interpretation? You own that transparency between provider to family and the patient. Asking for clarification gives you an opportunity to offer transparency so that the provider and the family can all be on the same page, because maybe the provider needs to change their approach, their tactics with trying to communicate a new diagnosis with the family, because we can't put all that responsibility on the 11-year-old patient to remember everything that the doctor said, right? We have to make sure the parents are on board. And remember, if everyone spoke English, that doctor probably would get some cues from the family that they're not understanding what's being said. So this is your job as the interpreter to ensure that communication access is happening and it's effective. You are a quality, top-notch interpreter because you're worried about that effectiveness piece right there. And using clarification to assure that is part of your job. Not just if you're confused, but if you get the sense that something is not right and you want to put it back on the provider or back on the family to ask further questions. Okay? Part of those clarifications might come into intersecting fields and vocabulary, as Tatiana is going to get into.
Okay, yes. It is definitely expected to talk about medical terminology, in some of these appointments when, you're a patient or you're an interpreter in healthcare. But have you thought of what non-medical terms may appear in some of these sessions? Well, there's one type we thought about, which is almost 100% sure that would appear because of the diabetes diagnosis, and it is food terminology. Most likely this patient is going to have appointments with a nutritionist or a dietitian, and this is an area where you may have to ask for clarification often, okay? So believe it or not, I would say based on my experience and my colleagues' experience is something we talk about often. Interpreting names of food can be challenging when the patient is not from your country or from your region. Even though the patient speaks your language, both of you can name the same food differently, or you may come to find that the same name refers to two different foods. So for example, since our patient's family speaks Arabic, and I apologize in advance, I'm gonna butcher some terms here in Arabic, but I can tell you that in Egypt and Palestine, the word harissa refers to a type of very sweet dessert. But in Tunisia and other North African countries, that word is used to refer to a hot chili pepper paste. Can you imagine? One is like a dessert, very sweet one, and another one is a hot sauce with a totally different content of carbohydrates and sugar levels and all that. Also in most Arab countries, what we call I'm combining two words, grape leaves are actually called the equivalent of grape leaves in Arabic. Okay, I'm not gonna mention it right now because I'm sure I'm gonna butcher it. However, in certain regions, they use other words for grape leaves. For example, the wali in Palestine, or yalanji in Syria or in Lebanon, or dolma in Iraq, okay? So another example that has to do with food is the word laban, which means milk in Egypt, but it means yogurt in Palestine and Jordan. So imagine all the differences. And if you speak Spanish, like me, you know that there are 13 different ways to say popcorn in Spanish. So it can be very confusing. And you may ask why would someone talk about popcorn in a medical session? Well, let me tell you that that's actually a healthy snack that many dietitians recommend. Of course, just with a hint of salt and something like that. Not nice, caramel cover popcorn. That's not what I mean, okay? And also, if you speak Spanish, you may know that when a patient says agua fresca, which literally means fresh, like literally would be fresh water, doesn't really mean just water. You know, in some countries that's a juice, a mix of fruits, flowers, and herbs with some sugar and water. Okay, so that for a diabetic patient who reports drinking that versus its little interpretation will be provided with much different instructions, and that may affect the treatment and outcome. Okay, so in this case, I would say that internet searches are great, are useful. However, most likely asking for clarification or giving a few options to the patient or family when you're interpreting will be your best approach. Okay. Now, imagine that our patient's family is feeling overwhelmed and nervous with a diagnosis, all the information received and all the changes, you know, they will have to make as a family for the rest of their lives, you know, to help the patient. You know, it's crazy, you know, when someone gets a diagnosis like that. Well, this family's way to cope is to pray. And they have requested someone to come pray with them or for them, okay? So another intersecting field is what we have here, is interpreting for spiritual care in healthcare. And this is an area, you know, like the other one that you may need to ask for clarification, okay? This topic is often seen in healthcare interpreting, remote interpreting, and there's no way we can predict when it's going to come up, okay? This has been a controversial topic among interpreters, language service organizations, and providers for multiple reasons, okay? But one concern that I want to mention right now is the fact that some medical interpreters don't want to interpret for spiritual care if the patient practices a different belief. I'll tell you that my personal belief and my professional way of thinking about this is that it is okay to have different spiritual beliefs or faith. And it's also okay to have no spiritual beliefs at all, right? We must respect that. The bottom line is, as interpreters, we're called to serve our patients in healthcare communities, and spiritual care may be an important part of patients' healthcare, okay? So in this case, we have to focus on the fact that the content of the interpretation has nothing to do with us as interpreters. We're there to serve others and convey the message following our professional guidelines. So I would ask you to focus on the tips that we have here on the slide to help you navigate these type of scenarios, okay? Always remember the user's words are their words, okay? Also, shared beliefs could make the encounter very emotional. So if coincidentally the interpreter shares the same beliefs as the patient or family, it's good to, you know, it can get pretty emotional, and it's good to debrief with a trusted colleague after the session. Always practice transparency. Let them know that you're not familiar with a prayer or a rite or something like that. It's going to be interpreted. Also apply strategies to negotiate. Many times you are there as the interpreter, but when you express that you may not know what that prayer is, or you're going to look it up to help, they may say, oh no, it's okay, I'll start the prayer. Just tell the patient or ask the patient what she wants to do or he wants to do, and the patient may say, I'll pray in my own language, that's fine, let's just pray together, we don't need an interpretation for that. So, and of course, have resources pulled up because you may have to interpret, okay? So being ready will help with a smoother spiritual care interpretation. And this is all part of being a professional interpreter, okay? So speaking of being a professional interpreter, Danielle is gonna start wrapping up some of this.
Yes, if I could just interrupt to point out, we only have 9 minutes left, and I have accumulated scores and scores of questions for you. So if you could wrap up quickly and we could at least get a few questions in. Thank you.
Absolutely. And I noticed something happened to Danielle. I don't see her online right now, but I can tell you that we wanted to share that there are many, organizations, well, the main organizations, professional organizations um, that are focused on medical interpreting are the International Medical Interpreters Association, or IMIA, and it actually has chapters in different countries: the United States, Japan, South Korea, Brazil, Costa Rica, India, you name it. There are many more. And also the National Council on Interpreting Healthcare, that's from the United States. And I'm very proud to say that the United States is actually a world leader in the field of medical interpreting. So we have a lot to do, still a lot to do and to improve, but we can, we've been a leader so far. And I see that Danielle is back.
Yep.
Danielle, I hope everything's okay. But
yeah, Zoom decided
I started
to
giving
crash
them a little
on me.
bit. Okay, I started giving them a little bit of information since we're short in time.
Yeah.
So
Great.
Yeah, so we're more than ready for Q&A, in fact, Danielle, because there's only 7 minutes left and scores and scores of questions.
Okay, good.
So do you, really eager people, do you think it would be okay to open up for questions now?
Absolutely. And sorry about that. Zoom crashed on me, so I was just trying to get it back up and running, but I'm glad it came towards the end of it where we can do Q&A now.
This is the important part, and this absolutely happens. We talk about that in online training for interpreters. Is just something to expect.
Yep.
And there are so many questions that I'll just have to pick and choose ones. But to start right away, when interpreting through video, is it a good idea to not show the interpreter on the screen to help the patient concentrate on talking to the healthcare provider?
I think it's really important for that visual connection, that ability for them to see you when you're with someone who speaks your language and understands even at a superficial level your culture. Just that engagement might actually be better for them to put their focus and energy into what you're saying when they can see you versus them just being able to hear your voice. I don't know how you feel, Tati.
Yeah, I would agree with that.
Yeah.
Absolutely.
Thank you. Do you anticipate, either of you, that some of the RI sessions will be pre-scheduled in the same way that face-to-face sessions have been scheduled?
I would say that maybe for languages that are not as common, because let's say Chuukese or, a language like that, it's very rare in the sense that, there are only a couple of thousand, no, maybe 30,000 people in the world who speak that language. And from that number, imagine how many people are here in the United States or in your country. And then of those, how many of those are interpreters and really qualified to interpret? So it's probably a handful of people in some countries, and you may have to make appointments even if it's VRI.
Yep.
Next, can we do whispering simultaneous interpretation for the parents while the doctor speaks with the child?
Well, sometimes it will depend on the platform that you're using, the video remote platform. Most platforms used right now for healthcare are more consecutive. So it's hard. In the one that I've used, you might be able to get it, but most of the time, even if you're whispering, you cannot hear, like you're blocking what you hear. When you're talking, you're blocking what you hear, and vice versa. When they're talking, they cannot hear you. So it's very difficult to jump into simultaneous in some of these platforms.
Thank you. This is a question that says, is this right at the end? When a doctor says the name of medications, we can advocate by saying, this is the interpreter speaking. Will you please spell that, right?
Oh, absolutely. Absolutely. You're not a subject matter expert. You're not a genius like Tati, who's a pharmacist. and you're not supposed to know how to spell things. Most days can still not really spell ibuprofen. So it's fine to ask them to spell it out, or even have them write it down for you and show the patient. It's not that we have to just assume that we need to intrinsically know all of these things. It's okay to ask for support and ask for that for that clarification or spelling or writing it down.
I would beg you to do it. Please ask for spelling. Yes.
It can only help everyone, including the patient, right?
Mm-hmm.
Next question, you ask all participants of the video call to identify themselves. They do, Doc A, pathologist, Doc B, oncologist, so on. You need to remember their names and specialties. How do you do that? By writing down all this info fast enough so that the interview time is not affected?
I mean, you can, but like I also feel like you can say, this is the interpreter. I'm sorry, who was just speaking? I mean, you're not there. You can't, and this is about teaching providers too, right? Teaching them the dynamics. And it's going to be a little clunky, especially as we go from largely on site to heavy in person or remote. And so until they learn to identify themselves better, it's okay. And so you can say, this is the interpreter. Who was that again? And it's all on your delivery, right? It's especially on video. You have that visual cue of you really are just asking for clarification one more time. And when you're over the phone, you have to, because it's hard to understand those voices. You may have people who have very similar voices or how far away they are. It's your job, quality and effective communication. And this, especially in healthcare interpreting, is no time to guess and no time to omit. So don't worry about asking. Remain professional, remain polite, and just ask.
Super, thanks. What do you two recommend to improve voice quality and resources for that?
Well, I can start by telling you that, believe it or not, just sitting straight with a smile on your face helps a lot.
So true.
It does.
So
Okay.
true.
More specific, maybe linguistic things, I don't know off the top of my head, but I don't know, Danielle, if you have any resources.
It's confidence. I truly believe if you're in a healthcare environment, you're there because you should be. You don't enter healthcare interpreting on a whim. It's a very serious environment. I like to think that the most dangerous places for non-English speakers are in a courtroom where their life can change and in a clinic room. And so if you're in that environment, then you have done your work, you've done your studying, your training, you're practicing, you've got a mentor, you've got someone you're working with. So be there and be confident knowing I'm Danielle, I'm your sign language interpreter in this environment, and I should be here. And ask for clarification without being ashamed, and speak boldly and faithfully to the message. So don't have that smile in your voice if I'm giving a cancer diagnosis,
Right.
but speak boldly with your voice and be okay that you're not expected to be perfect. You're not expected to know everything, but if you're going to ask for clarification, own it.
And I'm actually going to take the unusual step of commenting too. Deep breathing, Toastmasters International for public speaking is just, I always recommend that. There's even some bilingual ones. And voice coaching is not necessarily a bad investment for an interpreter who is going to be doing a lot of remote interpreting. I don't usually comment, but that went outside remote interpreting a little bit. So I felt that I could add to that. I'm actually going to close by saying that someone has asked this question for the last 3 weeks. We are at 12:30, and I intend to carry on this conversation after, because I'm going to be staying on. As I mentioned at the start, if you missed it, I am the owner, director, founder of Cross Cultural Communications. So I'm going to stay on anyway to answer questions. But before I let Tatiana and Danielle go, someone has been asking the same question for 3 weeks, she said. And I'll ask you to comment, but I'm going to comment too later on. Could the presenters or Marjorie or someone comment on the loss of prestige and the grief that many of us are feeling in this transition to become, quote, talking heads, and give up the comfort and connections of our in-person gigs? So although we're going slightly over time, I thought you might just want to say a little parting word to that poor interpreter who's obviously sad.
I mean, we're interpreters because we're people, right? And the whole world is shifting. And so I think if we can really embrace it and take on this attitude that language access is a right, it is an essential service, and you are an essential worker. And every time you pick up the phone to interpret, every time you get on screen to interpret, your service, especially now, is just so valuable and needed, and that you are giving a voice to that person who doesn't speak English. And so while you're losing that physical connectivity in person, you are bridging a language and cultural gap that is so pivotal right now that it, to me, actually outweighs being in person. And I just, you know, we're an essential service for a true language access right. And I think that that's the piece that puts me through not being on site and seeing people every day anymore in person.
Beautifully put.
Yeah. And I would add just the fact that all modalities in interpreting are important. Okay.
Mm-hmm.
All of them. And if you're going from face-to-face to more remote interpreting and all that, don't feel bad about it, in the sense that you're learning how to help in a different way. It's still a very efficient way. It's just different. Okay, it's different, and it's not applicable to all the scenarios, but it's still very important, and it helps our patients in this case in a very, very timely fashion. And it's going to be on you to make it seem less robotic, less about the technology than anything. So you, as a professional interpreter, are going to represent all modalities, no matter in which modality you are, working at that moment.
Yeah.
Okay?
The gift is in video. You have that humanity that you can see. I mean, that's if you can't be on site, you can be in video, and just that patience and grace for the whole process, it can really carry you through.
Well, I want to thank both of you for staying on that bit extra, but of course, mainly for an extraordinary presentation. I know from both the intensity and sheer overwhelming number of the questions, and also from the chat and the thank yous and the gratefulness, that your talk has been deeply appreciated, and the expertise that you bring to the table has been a true gift to the interpreting community. Tatiana and Danielle, thank you both so much for this amazing presentation. You'll be hearing about it for a long time, I'm very, very sure.
Thank you. It's such an honor and a privilege to be part of the Remote Interpreter book, and to be working with other champions in the field, and truly just to be partnering with the 861 interpreters that are on here right now. It's just wild. So thank you so much for the invitation to be here today. I'm deeply humbled and grateful to be a part of it.
Yeah,
And we are honored.
It's I don't know. I don't even know what to say, what else to say. It's just so exciting. It's really so exciting. Yeah, it's very exciting to be here.
You are incredibly generous. Thank you for sharing.
Thank
we
you.
will bid you a wonderful rest of your day, hopefully a peaceful one after your exertions today, on behalf of the interpreting community. And I will stay on in case anybody has any questions about their certificates, about anything to do with CCC. But you ladies, have a wonderful day, and thank you so much.
Bye, everyone.
Bye.